Hello, my name is Queenan. I'm a neurosurgeon working with the Genetix program. I'm here to talk to you today about how excess weight can affect your spine and your overall health. It is clear that people who are overweight will experience more back pain over the course of time. Studies have shown in certain areas that the years 1992 to 2009, obesity has increased in its prevalence from 10 to 15% in some areas to up to 20 to 25%. At that same time, chronic low back pain has increased from 3% to 12%. Now, why would weight affect your spine? Well, I can show you that very easily. Here's a model of the spine. When people begin to have excess weight, they start to compensate for that like you would if you were trying to lift up a package by moving their pelvis forward. When one moves their pelvis forward, they tend to tilt their spine back. That puts excess strain on all of these discs. All of these are little joints. These are individual joints that hold your spine together. They're supposed to move in concert. As you start to do that, you will start to bend the top of your spine forward, and again, putting excess strain on all of those joints. This is not unlike putting excess strain on the joints around your house. For example, if you had a door that you opened and closed constantly, the joints would probably be okay. If you put a bowling ball on the handle of that door, eventually those joints would start to wear out. Now, how can we avoid this type of process or make it better? Well, it is quite clear that with weight loss and exercise, we will improve the situation that our back is in and will decrease the amount of pain. Now, why does that work? That works because, one, if we start to have some increased muscle mass, and there are very large muscles that sit here, that will help to support the spine so that we won't rely on the joints. Two, increasing exercise will bring blood flow into the area. That blood flow is important for healing if the injury does occur, but it's also important to bring nutrients into the area to keep things healthy, such as the discs and again these ligaments and the other soft tissues. With excess weight, oftentimes people feel more fatigue and are less inclined to exercise. So again, very important how all these things fit together. As little as a 10% weight loss can cause people to have significant health improvements according to the American Obesity Association. If we also condition our anterior muscles, the rectus abdominis, and we're not looking for a six-pack here, just some strength, that also helps to hold our spine in place. Whenever we move, we should try to stand upright, keeping our spine locked this way and with our pelvis back. That becomes more and more difficult the more weight that we have in front of us. There have been several patients in my care that have decided that they wanted to do something other than have surgery. And I've explained to them over and over again that weight loss and exercise is usually our first goal. 90% of patients will get better, improve, and resolve their back pain with simple conservative measures. I have a particular patient who had a very large operation planned with screws and rods to support her spine. And she came to me and said, I really would rather not have the operation. Is there really anything we can do? And we had a relationship that extended over the course of a year. And I said, well, I've been telling you all along that if you lost weight and strengthened your back, this would probably make your pain go away. She said, I'll give it one more chance. She came back to me 3 months later, jumped off a table, showed me that her pants didn't fit anymore and her pain was gone. So it was quite clear that weight loss will affect the pain in your back.